Hi, I'm Dr. Mike Milligan. We are here at the American Academy for Oral Systemic Health meeting in Chicago, Illinois. I have one of the keynote speakers with me, Bob Maccario. Bob, thank you so much for being with us.
My pleasure.
So Bob, tell us about Oral SysteMix, that's the company, and then Dental ETC, the software.
Well, Oral SysteMix, the company, is about integrating oral systemic care into a dental practice.
Right.
The software, Dental ETC, Electronic Treatment Coordinator,
Yep.
is about the implementation of that process. We're finding that all the doctors, they understand the science, but when it comes back Monday morning to input it,
Right.
they hit a wall.
What do I do now? This is great information, and I want to put this in my practice, but what do I do now? Well, that's where you come in.
Yes. We actually even have signature protocols. Companies like Protect and Oral DNA, they actually have the protocols saying, okay, click on this and this is how you do it,
Right.
Monday morning.
Right.
All right? And then it actually prints out a protocol, and you can customize the protocol to the patient and to the practice philosophy, but it actually prints out a protocol so the entire team is on the same page. Gives me the numbers, what it costs for the patient, so I can do a financial arrangement, and then also prints out a beautiful report to the patient of explaining why the care is necessary. So it facilitates the communication. And then the next step, which is really exciting, is you click the button and you can actually send a letter to the MD or the other healthcare professional, so you can communicate whether you need HSCRP or whether you want to send some information, to them and say, hey, this patient's healthy.
Right, absolutely.
So it's a click, 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 and it works real fast.
Very simple, very quick, very thorough, and it's a great it helps you walk through the diagnosis of the patient. So
it's a pilot's checklist.
Right.
So you make sure you're doing the same thing every time.
Yep.
But it helps you organize it so you, as the dentist, can make that personal diagnosis. Okay?
Exactly,
So.
and helps you make that diagnosis, then keeps it all organized. Everyone's on the same page.
Yep.
And then helps you communicate both to the staff, to the patient, and to any other physicians that you want to get the information to.
Exactly.
Helps you communicate that to all those people, all in a simple program.
Exactly. Yes, you could do all of it manual. You could put it in an Excel. You could put it in a Word document. But what we've done is program it so it's basically seamless.
Right.
So, because as you know how busy you guys, all you doctors are, I need a click, click, click so I can keep taking care of patients.
You bet. Now, what else would you like to tell us about Dental ETC before we close here?
That's pretty much about it. Okay. It is endorsed by the American Academy of Oral Systemic Health. The boards looked at it and said, yeah, that's the new tool.
That's the
so
new tool for
a lot of the manufacturers like it because, as I mentioned earlier, the manufacturers are finding out that they can teach the science. Okay. Like Oral DNA, they can teach the science, but getting it implemented into the practice is the hard part, and that's where we come in.
Right, fantastic. Now, how do we get in touch with you?
The best way is you can go to thedentaletc.com on the web. That's the best way.
Yep.
All right. Or my own line is 800-332-0363, extension 2 pound. That's the easy way.
Super. Bob, thank you so much for being with us.
My pleasure. Thank you.